This is All India Radio. In the program Spotlight, now we bring you press briefing by AIIMS Director Dr. Randeep Guleria on Covaxin human clinical trial.
वैक्सीन सेफ है और इससे इम्यूनिटी ज़्यादा मिल रही है और वैक्सीन इज मोर इफेक्टिव। तो ये फेज 1 ट्रायल पहले होगा, उसके बाद फेज 2 टू सी हाउ इम्यूनोजेनिक इट इज। दैट इज फॉलोड सब्सिक्वेंटली बाय फेज 3, जिसमें लार्जर पॉपुलेशन के साथ किया जाता है टू सी कि उसकी एफिकेसी और थेरेपेटिक बेनिफिट कितना दे रही है, कि जो लोग इन्फेक्ट हो रहे हैं उसको कितना प्रोटेक्शन मिल रहा है वैक्सीन लगाने के बाद कोविड-19 ना होने का। साथ में एक कंट्रोल आर्म भी होगा जिसको हम प्लेसिबो कहते हैं। So some people will get the vaccine, some will get a control which is not the vaccine to see कि दोनों में कितना अंतर इम्यूनोजेनिटी का। जो ट्रायल है वो एम्स में हो रहा है। अपने प्रिंसिपल इन्वेस्टिगेटर है डॉक्टर संजय राय, जो कम्युनिटी मेडिसिन में है। ही विल बी कंडक्टिंग इट बिकॉज ये हेल्दी वॉलंटियर्स में है। उनको हेल्प डॉक्टर पुनीत मिश्रा जो वहाँ प्रोफेसर हैं वो करेंगे, और एम्स के और सब विभाग, चाहे वो इमरजेंसी मेडिसिन हो या और डिपार्टमेंट्स हो, वो मदद करेंगे टू मॉनिटर फॉर एनी सिग्निफिकेंट साइड इफेक्ट। तो रिक्रूटमेंट प्रोसेस अब शुरू हो गया। हम उम्मीद ये करते हैं कि जल्दी से जल्दी हम जो हमारा टारगेट है 100 पेशेंट का वो हो जाए। जब 50 पेशेंट हो गए तो उनको हम मॉनिटर करेंगे, जो डेटा सेफ्टी मॉनिटरिंग बोर्ड है उनको डेटा देंगे। फिर उसमें जब लगेगा कि ये सेफ हैं, फिर हम नेक्स्ट फेज में जाएंगे जिसमें फिर और पेशेंट को रिक्रूट करेंगे। क्योंकि जब भी हम वैक्सीन शुरू में ट्राई करते हैं, सबसे ज्यादा जरूरी है कि वैक्सीन हैज टू बी सेफ। यू कैन नॉट हैव अ वैक्सीन विच कॉजेज मोर हार्म देन गुड। तो इसलिए फर्स्ट स्टेप इज ऑलवेज टू सी सेफ्टी। पहले स्मॉल नंबर्स में अगर उसमें सेफ लगता है देन अ लार्जर नंबर, एंड यू कैन इवन गो टू अ हायर डोज टू मेक श्योर कि व्हाट इज इट इज सेफ इवन एट अ हायर डोज। और उससे थोड़ा आइडिया हो जाता है कि व्हाट इज द एग्जैक्ट डोज दैट इज रिक्वायर्ड फॉर गिविंग द वैक्सीन। तो डोज जो रेंज है वो भी इससे कैलकुलेट की जाती है। तो दिस इज इन ब्रीफ अबाउट दी वैक्सीन। जो अलग फॉर्मुलेशन उसमें एडजुवेंट्स हैं। एडजुवेंट वैक्सीन में डाला जाता है जिससे उससे उसकी इम्यून रिस्पॉन्स बढ़ जाए। तो कई वैक्सीन हैं जो होल वायरल वैक्सीन हैं, इवन जो इन्फ्लुएंजा की वैक्सीन आती है उसमें एडजुवेंट डाला जाता है जिससे उसकी एफिकेसी ज्यादा हो और वो बॉडी में इम्यून रिस्पॉन्स बेटर बना पाए। तो इसलिए सिंपल विदाउट एडजुवेंट एंड विद एडजुवेंट मल्टीपल डोजेज विल बी ट्राइड, क्योंकि दिस इज ऑल्सो एन एक्सप्लोरेटरी स्टडी। पहली चीज तो ये कि डोज कितना होना चाहिए वैक्सीन का, दूसरा किस एडजुवेंट के साथ वो सबसे अच्छा रिस्पॉन्स देगा, और सबसे इंपॉर्टेंट चीज की वैक्सीन जो है वो सेफ होनी चाहिए। It is dependent on multiple factors. One is, of course, that everything goes right, that we find that it is safe, it is immunogenic, and we have no issues of side effects, and the report suggests that it is good. If that is there, then I think in the next 2 to 3 months we should be able to have a result. But remember, you have to follow up these patients. So even when you give the injection, to look for side effects, the follow-up is for 28 days. So even if we complete all our recruitment, let's say by the end of this month, then for another 28 days you will have to follow up the patients to really say that now it has been safe, and then they will be followed up even subsequently, because we know that some vaccines can lead to side effects जो बाद में होते हैं, they may not be immediately. So एक तो आपने 2 घंटे में देखा कि local reaction तो नहीं हुआ, कोई एलर्जी रिएक्शन तो नहीं हुआ, anaphylaxis, but we also know that some side effects can have a late onset. So the subjects will be followed up even for a longer period. It's already been developed in the study design, and we have already, the co-investigators are from emergency medicine from other departments, and the strategy is there कि अगर किसी को मान लो anaphylaxis होता है, allergic reaction होता है, he will be immediately taken to the emergency. The vaccine will also be given in an area which is close to the emergency, कि वहाँ पे हम अगर कोई reaction है तो treat कर सकते हैं. And even at the site where vaccine is given, normally we have what we call a crash tray, कि अगर कोई reaction हो तो आपके पास steroids हैं, adrenaline है, जो दवाइयाँ चाहिए होती हैं वो हमारे पास ऑलरेडी होती हैं. There is a team of medical experts who will monitor closely for the while the patient is getting the initial dose, और बाद में भी there will be constant monitoring for any side effect. So it has started, I think, in almost all centers, and some centers have also recruited some patients. It will depend on recruitment. We will want कि जितनी जल्दी recruitment हो जाए उतना ही करें, and secondly the follow-up that has to be done. So since this is a study which will go from phase 1 to phase 2, it's a combination of phase 1 and phase 2. So we are hopeful that in the next 2 to 3 months we will be able to complete both of them in a go, but that is subject to good recruitment, one, and secondly the vaccine showing safety and efficacy. मान लो efficacy इतनी नहीं आए, then you again try and do a dose adjustment कि आपको adjuvant और तो नहीं add करना है. Have to, this is science, so you have to see how things evolve and then develop it. That is the first thing. So I think that is an important thing to remember. But yes, phase 1 human trials have started, and this is something which is very heartening because this is an indigenous vaccine. In India, we are very good in industry in terms of making molecules but we don't do R&D. So making a new vaccine is something which is of great achievement for India, that we are now into research and development in the pharmaceutical industry, making our own vaccine and being able to then mass produce it. We are very good in mass production. I feel that even if a vaccine comes from any part of the world, India will be involved in its production because 60% or more of the vaccines of the world are being made in India. There are two parts in this. One part is efficacy of the vaccine. How effective is the vaccine in terms of antibodies, and how long does these antibodies last? They can last for 6 months, they can last for 1 year. There are some vaccines जो once in a lifetime है. हम vaccines कई ऐसे लगाते हैं जो हम कहते हैं एक दफा लगाओ फिर आपकी immunity lifelong रहेगी. But there are certain vaccines जो हर साल लगाने पड़ती हैं. Influenza जो है. That is not because the antibodies are less, but because the virus also mutates. So one is the antibodies you form, how long do they last? But it should also be that the virus has not changed so much that the vaccine that you gave is now not effective because the virus has not changed to an extent that it is not, the antibodies that you all have are not effective against that virus. COVID doesn't change, it doesn't have what we call an antigenic drift that much as influenza has. So it's unlikely that that will happen, but it is something we need to see because this is a novel virus. So how does it behave in the next few months or years is something we will have to see. And how much is the vaccine causing the immunity is also something that we need to see. So it's still early to say. The virus is only 6-7 months old. The virus is a new virus. So I think it's difficult to predict, but I'm hopeful that the vaccine will give immunity at least for more than 1 to 2 years. So whenever a vaccine comes, you have enough doses to give it to everyone. You will have to prioritize. This was done for H1N1 also. This has been done in the past. And the priority is two groups that I think we need to look at. One is the high risk groups, because the aim is to decrease mortality. So elderly, those with comorbidities who are having a higher chance of dying because of the disease should be prioritized to give the vaccine. And secondly, those groups which have a higher chance of exposure of getting the disease. So it could be healthcare workers or those who are the so-called corona warriors. So those are the priorities that we will have to develop. It will depend on number of doses that is available and the number that we have to vaccinate. So prioritization करना पड़ेगा. आस्ता आस्ता जैसे जैसे doses बढ़ेंगे, it will become more and more liberal and more people will get vaccinated. So this is an important issue. One is the how long does the immunity last? So normally what we would do is, in a vaccine takes sometime even 10 years to develop. और वो इसलिए कि आप पहले phase 1 करोगे. Phase 1 को आप evaluate करोगे, उसके बाद you will go to phase 2. And then you will go to phase 3 after because it is an investment. आपने मान लो phase 1 किया और आपने ये देखा कि vaccine is not safe. Then you go back to the drawing board. Here we are taking that risk that this is going to be safe because of the animal studies that we have. It will be effective, so we go on to phase 2. And at the same time, we are working on the manufacturing. Now this is an investment. The US is doing it, India is doing it, that simultaneously a manufacturing plant is also being created. कि जिस दिन vaccine trial से खत्म हुई, उसके अगले दिन ही manufacturing शुरू होगी. Normally this is done in steps because you don't know that one step will lead to the next step. One step may not lead to the next step and you may have to go back and then develop another strategy. But because we want to compress everything and save time, we are taking that risk that things will happen and we assume they will happen. When will it be available? It will all depend that everything works in a good manner as we are hoping it will. It is possible that we may say that the vaccine is safe, then we find that it is not giving that much efficacy. So should we now do something more? That may take a few more months. So therefore, predicting exactly when the vaccine is going to be ready is a difficult business. But if we say everything will work ideally, then by the end of the year or early next year, we should be in a position to say we can start manufacturing. But then there's a lot of ifs and buts in that. Secondly, the question was about the immunity. So the vaccine should produce what we call neutralizing antibodies, which is to say that it neutralizes the antigen, that is the virus, in good amount. But we are learning more about the immunity of the virus. वायरस के बारे में कुछ हमें इतना पता नहीं था. अब हम ये भी देख रहे हैं कि there is a good T-cell immunity and that is also causing some degree of protection. As a matter of fact, there is an interesting study from Singapore where they have found that some people who never got COVID had already T-cell immunity, very good T-cell response. And it is believed that maybe one reason why Southeast Asia is protected and has less severe diseases, that we also have other coronaviruses which are causing mild illness, circulating in Southeast Asia and there is cross reactivity. एक इन्फेक्शन हुआ तो उससे दूसरा कोरोना से भी कुछ हद तक इम्यूनिटी मिल जाती है. तो ये भी हो सकता है कि कुछ हद तक हमारी पॉपुलेशन में माइल्ड कोरोना का जो पुराना स्ट्रेन है उससे एक्सपोजर होके कुछ हद तक टी सेल इम्यूनिटी आ गई और अब इसलिए वी आर हैविंग माइल्ड इलनेस, अनलाइक व्हाट इज बीइंग सीन इन द वेस्ट. So that is very important. Vaccine is being given for two reasons. One is to healthy people. It is utmost important that it has to be safe. And there have been past examples. In the 60s, there was a measles vaccine which caused serious side effects. We've had a vaccine in the 70s which was given for influenza which caused what we call Guillain-Barré syndrome. People had some degree of weakness and paralysis type of a syndrome. So vaccines and the adjuvant have to be looked at very carefully because that will be a big setback for the whole program if you are not taking care of safety. So this is one of the theories based on research paper from Singapore which does suggest that we may have some degree of inherent immunity. So the issue is people keep saying this and this is being sort of questioned a lot in the West. Why is the mortality low in Asia? There have been so few mortalities even in Vietnam. Vietnam has I think only 1 or 2 deaths. Vietnam is a developing world. We are there to have so few deaths and US has so many deaths. So what is different? So one of the reasons could be that we have had some exposure in the past in Southeast Asia with a variant of this virus which we know is circulating even before, which causes mild flu-like syndrome. And maybe there is some inherent exposure-related immunity which we have, which is causing a milder illness. So this is one theory. So there are multiple studies. This is one of the studies which is going on. The other study is, does BCG vaccine protect? So there is a study which is going on to see the role of BCG vaccination and whether we should give BCG vaccination to elderly. A study is being done, funded by SMR, where all older people in a randomized way like this will be given BCG vaccine and we'll follow them up to see are they protected. So there are multiple theories. I can't say that definitely this is right or that is right, but definitely if you look at data from Southeast Asia, I'm not even talking of India, the whole of Southeast Asia, the mortality is much lower than what happened in, say, Italy, Spain, or what is happening now in the US. My feeling is that certain areas have hit their peak. Delhi seems to have done so because the cases have declined significantly. But certain areas are still to peak. There are cases increasing in certain states. They will peak a little later. So that will happen to some extent because initially cases were more where there was a large degree of population clustering, dense population like metropolitan cities. But gradually some will percolate down to tier 2 cities. There the peak will be much lesser because the density is not that much. So you will have cases becoming more in now smaller cities. I hope that it will not be as many because if you look at say Mumbai, Delhi or states where you have huge population clustering, in a small area 5 people are living in one room. So the chances of a large number of people getting infection there is much higher than in say a rural area where people are still scattered, or a small cities where still people live separately and have good gardens in the house. We don't have it as far as bigger cities are concerned. So some states in the south, I think Ahmedabad also is showing a decline. The central part of Mumbai is also seems to be showing a decline. The other important issue which I would like to stress is that having hit the peak and come down does not mean that you have to let our guard down. In many cities, not only in India but in the world, especially in US, when people have felt that the peak is over and suddenly they have started, not doing social distancing, not wearing masks and things like that, there has been a spike of cases. So even if the cases come down in a city, infection control measures, containment measures, contact tracing, preventing a development of clusters becomes more important to sustain that. So there is now a huge strategy being to develop various institutes, and the government is also looking at even AIIMS and other institutes of national importance to have an infection control, infection disease center and outbreak management center. So there is going to be a network which will be created for surveillance and for upscaling our capacity if there is a need whenever there is an outbreak. So long-term planning has to be done.
You were listening to Press Briefing by AIIMS Director Dr. Randeep Guleria on Covaxin Human Clinical Trial. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR. This program is also available on our website newsonair.com. You may email your opinion about this program at airnsdtalks@gmail.com.